When you think of a healthcare provider, your mind probably tends to wander towards a doctor or a nurse who works in a hospital or a clinical setting. But did you know that everyday people like you and I are healthcare providers? There are jobs such as certified nursing assistant, a home health aide, or a direct service worker who provides the same services. I would like to inform you today what it's like to be a home health aide and the advantages and disadvantages of it. With being a home health aide, you have to be reliable, selfless, very compassionate towards your patients and what you're doing. There are many advantages and also a lot of disadvantages to being a home health aide. A few of the advantages would be your schedule. You get to make your own schedule, so your hours are really flexible. There's usually 3 shifts, so there's morning, evening, and night. You get to choose between them, and you can only work a couple days a week. You can work every day a week. It's just really flexible. Another advantage would be the fact that if you're going into the medical career, such as nursing, you learn a lot of skills such as like communication. Everybody has to communicate good with each other because we have to keep each other updated on our patient, what they did today, what they didn't do today, what medications they took, what medications they still need. Another advantage with that is you get to learn bedside manner and assisting them. So you're taking care of them your whole shift and helping them. Another advantage would be all the people you get to meet. You meet a lot of people from a lot of different backgrounds. You learn a lot from everybody. Everybody has something to teach you. You learn something new every day. It's endless. One of the disadvantages to being a home health aide would be the long hours, because if somebody calls in, you pretty much get called in. So your 8-hour shift could turn into 16 hours. 16 hours could turn into 24 hours. It's kind of endless. Another disadvantage would probably be when the patients are combative. Some patients are super easygoing. You just kind of sit there and monitor them throughout the day, and that's it. And then some patients, they like to fight. You will fight them with taking their medications, with taking a shower, with communicating with you. They just don't want to do it. The other downfall about being a home health aide is the salary is not that great. You don't make as much because you're only certified, so it's not a degree, but it is a great start. So another disadvantage is you get emotionally involved with your patients because you're there for them every day. You pretty much spend every day with them. You are their family and their support. So you kind of get involved in, like, if something happens to them, it kind of will affect you a little bit because you're like their person. So it can be hard mentally and emotionally. Another great thing about being a home health aide is that you get to travel over the place. So I don't just work in one area. I work kind of all over the Shreveport, Bossier area. I travel from house to house and help people. It is definitely a great job. I would recommend it to people if you are strong-willed and want to work in the medical field, because it is not for the faint-hearted. Definitely takes a lot of patience with them. It's almost as if you have your own child. It's like having a home away from home. You are there, you clean, you cook, you help them, and then you gotta go home and clean and cook. So that's kind of a disadvantage also. But at the end of the day, it is a very rewarding job. It is definitely something to consider if you're thinking about working in the medical field or wanting to try something close to the medical field. Yeah, so thank you.